The government is about to clear up the confusion about whether you need a COVID vaccine booster shot. At least that is the plan. FDA vaccine advisors meet tomorrow to decide whether to authorize boosters for those who receive the Pfizer vaccine. 3 new published reports last night do show boosters restore waning immunity in fully vaccinated people and that those boosters are safe. The NIH director says recent data out of Israel flipped him from a booster skeptic to a booster believer.
The people who got immunized back in January, by the time you got to July, their protection would really have started to drop off. And not just against any infection, but even against severe infection. And that's the signal you want to watch for to say, ooh, might be time to do something like a booster.
Let's get some insights now from Dr. Ijlal Babar. He's the Director of Pulmonary and Critical Care at the Singing River Health System in Mississippi. Dr. Babar, I just want to put up on the screen right now for our viewers, this is the current track of cases, 150,000 new COVID infections, 150,497 yesterday. That is 13 times higher than when we had the spring low. We were down as low as 11,000. But you do see at least a plateau here and cases down a little bit. In this COVID booster debate, there's been a lot of confusion. Do you believe the science and what you're seeing on the ground supports the idea that for those, we're on Pfizer first, if you got a Pfizer vaccine, you should soon get a booster shot?
Yes, John, I do think that it's going to help. I think one of the things that is propagating infections is asymptomatic carriage in the vaccinated population. And I think that is what the boosters are going to prevent.
And describe for me from your perspective as a medical professional, as a lay person, there has been some confusion, right? The White House said everyone's going to get a booster. Then there were conversations maybe only the elderly should get a booster. What do we need to hear? What do everyday Americans need to hear from the FDA to clear this up?
I think they need to know exactly which people should be getting it when. I think at this point, the immunocompromised are definitely people who need it. I think ultimately all of us are going to need these boosters, but I think the FDA needs to be very clear on which people at which point, how far out, are going to need to get these boosters.
I think that would be very helpful. I want to walk through now, as we're back in school, obviously, and we've seen a lot of headlines, a lot of data telling us that COVID cases among children are rising. You see the red on all this map here. This is the CDC's map of high community transmission. Red means you have high community transmission. It's a little better than it was a couple weeks ago, but you still see it's pretty bleak. But in Ohio, 44% increase in COVID cases in children just in the past week. In Georgia, 60% of the COVID outbreaks in the past 60 days have come from schools. Doctor, help us understand. Obviously, many of the youngest children can't get vaccines yet, but what needs to be done to turn these numbers around?
I think vaccination for children who are over 15, and I think masking. I think that's how it's going to be prevented. I also think that the school personnel should be fully vaccinated and should be masked. I think those things are going to prevent further transmission.
Unfortunately, they become part of the political debate in our country as well. I just want to show right now, as of Wednesday, 2,111 children hospitalized with COVID. That's 3 times higher than it was 2 months ago. Obviously, we have back to school here. It is down a little bit again in recent days, and we hope that continues right there. Doctor, in your own community right there, Singing River Health System, 17% of the COVID patients are 19 and under. 32% if you start at age 29 and down. This is new, right? More younger people hospitalized with COVID?
Absolutely. Apart from the numbers you've mentioned, we've had people under 50 just completely filling up our ICUs. We've had about 17 or 18 deaths and people under the age of 40 since this began. And these are people who shouldn't have seen the inside of a hospital, and they're dying in our ICUs.
That's the saddest part. Never should have seen the inside of a hospital. There are vaccinations available for them. Dr. Ijlal Babar, grateful, sir, for your insights and help as we sort through this. Appreciate it very much.